Hello, my name is Kim Seaton. Welcome to my presentation of Part A of the final exam of the diabetic foot exam. We're going to start out here. The first thing you would do when you started the diabetic foot exam, of course, is to inspect the foot, inspect the skin, the nails, any bony prominences on the foot. You would look for edema, any distended veins that are present possibly, calloused areas on the foot, and these calloused areas are actually a protective padding from accumulation of hard skin on the foot. And it's actually from pressure that has been placed on the foot, normally just on the plantar aspect. It can be on any surface of the foot, but mostly on the plantar aspect of the foot, and can lead to foot ulcerations. You want to look for any deformities in the foot, such as a claw foot, pronounced metatarsal heads on the foot, and that can lead to an increased chance of foot ulcerations. And foot ulcerations and amputation are a major consequence of diabetic neuropathy, along with major causes of morbidity and disability in the diabetic patient. So we're going to go ahead and move on to the assessment with the monofilament. And the monofilament testing is actually used to assess for ulcer risk on the foot. And we're going to use a 10-gram monofilament, and what we would do is ask the patient to close their eyes during this assessment, and upon placement of the monofilament on the plantar aspect of the foot, on the great toe, the third toe, fifth toe, the metatarsal area, underneath the great toe, third toe, fifth toe, and along the lateral aspect in two areas, and also the lateral aspect of the heel, and on the dorsal aspect between the great toe and the second toe. And if the patient reports 5 or more not feeling the placement of the monofilament on the foot, that's actually indicative of the neuropathy and would require further evaluation. The monofilament testing does have a high sensitivity and specificity. It's not 100% though with detecting problems with diabetic neuropathy. Next, we will move on to the testing of vibratory sensation, and we are going to use a tuning fork for that assessment. And what we are going to do is we would activate the tuning fork and place it on the hallux of the foot and ask the patient if they do feel a vibration, and if they do, when the vibration stops. And upon the vibration stopping, patient reporting it stopping, you would place it onto your wrist. And if that vibration lasts for longer than 10 seconds than what the patient had initially felt on the hallux of their foot, that's going to be indicative of some diabetic neuropathy problems. You can also use the tuning fork for temperature sensation. With it being cold to touch, you can actually use that on the side of the foot, and with warming the tuning fork either with warm water or your hands and placing that on the foot for temperature sensation. And the tuning fork does have, again, high sensitivity and specificity for detecting any sensory nerve problems. Next, what we're going to do is actually assess the pulses in the foot, and we would assess the posterior tibialis pulse, and we would also assess the dorsalis pedal pulse. And this is going to assess for arterial blood flow to the foot, and should pick up on any problems if the patient's having with compromised circulation. And things that you would pick up with compromised circulation is the skin would be cool to touch, cyanotic possibly, and a loss of hair on the leg is another indicator of compromised circulation. Also, you can test the skin for blanching and the nails for blanching, and if there is a prolonged blanching of the skin and nails, that's actually indicative as well of compromised circulation. All right, so moving on, the next and final assessment would be musculoskeletal strength, and what we would assess here for is on a scale of 0 to 5, assess for muscle strength in the foot. So what we're going to do is 0 would be indicator of no muscle strength in the foot, and 5 would be good muscle strength in the foot, showing active movement against full resistance in the foot. So what we would do is we would have we would place our hand on the patient's plantar aspect of the foot and have them to push down on our hand. And grade that muscle strength. And then we would place our hand on the dorsal aspect of the foot and ask them to push against up, towards them, and assess for muscle strength there as well. And we would grade that. This is actually an assessment for polyneuropathy, which is a chronic polyneuropathy is a problem with diabetics in their condition. So, and the polyneuropathy is actually a disorder in which the many nerves in the foot, in the lower extremity area and throughout the body, actually malfunction simultaneously. So, lastly, what we want to do is also put diabetic foot education into the exam with the patient. And we would want to talk to the patient about assessing their foot daily for any bumps, bruises, cuts, sores on the foot that they may notice. And of course, report any of those problems to their physician or provider immediately so that those problems can be addressed. And if they need to use a mirror is very handy. Little apparatus that they can use to look especially on the plantar aspect of their foot for any problems there. We want to teach them to wash their feet daily with warm soap and water. Never use hot water because that can be an irritant to the foot, especially if they're experiencing neuropathy problems. On the foot, we want to be sure that they dry between their toes especially, and this also would be included in the inspection of the foot to look between each toe for any type of a fungal infection that can set up, because diabetics are very prone to that. So definitely would want them to dry between their toes after washing them. They would be advised to use a good cream on their foot before they put their socks on. This will help with dryness with the skin. To use a good warm soft socks, thick soft socks on their foot with protective footwear is advised as well. Never go barefoot. And calluses that may be present on the foot, what they would want to use, these are very prominent on the plantar aspect of the foot, and what they would want to use is a pumice stone and just gently remove that dead skin that may be present on their foot, but never to cut that off or use a sharp object to remove that, because that can actually cause serious injury and infection to set up. So it's definitely never advised for them to do that, to remove the callus, because it's actually a protective padding on the foot. We want to teach them also to never cross their legs when they're sitting, because that can actually impede and reduce the blood flow to the legs, and especially to the lower extremity, to the foot area. And if a podiatrist referral, if the provider feels that the patient needs to see a podiatrist and it's necessary, that's definitely something to consider as well, to refer them to a podiatrist. And during the evaluation and assessment of the diabetic foot, it's very important to get them started on a good assessment regimen with coming in to see you regularly in order to prevent and forestall any progression to a severe disabling, possibly irreversible condition in their foot, lower extremity area. Also, finally, it is imperative that the shoes and socks come off of the foot during the foot assessment in order for a comprehensive foot exam to be performed on the patient and a proper evaluation. Well, this concludes my diabetic foot exam. I hope you have enjoyed it. Thank you.